So a lot of folks experienced a cracked tooth. It happens whether it's an accident, over time, wear and tear. So how do you fix and treat a cracked tooth? Who better to answer this question than Dr. Pashmini? Welcome.
Thank you.
All right, let's dig right in. I have a cracked tooth. What do we need to do to treat and to fix that?
All right, that's a great question. I've actually been asked this question twice today by two patients who cracked their teeth. People must be stressed out this time of the year. So what happens is you initially start by, let's say you bit on something, you crack the tooth. Sometimes if it's a small chip or if it's an area of the tooth that we can just drill out and fill it, totally fine. But if you are actually cracking a cusp where the crack line is going outside the tooth, now you're chewing on the tooth and the tooth is very sensitive to being chewed on. Usually the perfect solution for that is a crown. So a crown is a full porcelain cap that goes over the tooth. And what it does is it hugs your tooth. So when you are actually chewing on it, this crack is not flexing and opening up constantly. I would say 90% of the time, the pain is resolved with a crown. However, if the crack is deep enough that is actually approximating the nerve inside the tooth, then at that point, you might even need a root canal on the tooth to be fully comfortable chewing on the tooth. But at the minimum, you need a crown, sometimes even a root canal if the crown doesn't resolve the pain fully.
So it's not something we can't just put in some cement or fill in the crack?
Usually not. So if it's an outside crack where we can visibly see it on the cusp of the tooth, then it's not a hole to fill anymore. I would say it's just on the outside. So you need to cover it up at that point. And that would be either an onlay, which is a very conservative type of crown. So if your tooth doesn't have anything else going on with it, it's never had a filling, you just sheared off a cusp or cracked a cusp, we can usually just replace a part of the tooth, so almost like a partial crown or a half a crown. We call that an onlay. That's usually very conservative. It fixes the problem. Or we have to, if you've had a previous restoration in the tooth where it has to be removed, there's maybe a decay, maybe there's other signs of wear on the other cusps of the teeth, then we would actually have to cover all of the cusps with a full coverage crown.
So basically all cracks are not created equal, it sounds like. But at the end of the
Exactly.
day, you need to get it professionally looked at, because obviously if you leave it alone, it could get worse over time. But if it is something minor, obviously you'll have that, that insight and be able to tell once you're in the chair. So very informative. We all get cracked teeth over time. Don't chew ice. I always remember being told that.
Chew ice. It's ice and popcorn. Those two are the main culprits of
All right.
cracking
Everyone
teeth.
remembers this. No ice, no popcorn, but we'll all have them.
Exactly. Well, eat the popcorn. Just be careful what you're chewing on, so you're not
Sure.
chewing on an unpopped kernel. Yeah.
Got it. All right. Very informative. Appreciate your time, Dr. Pashmini.
Of course. Thank
All
you.
right. Take care.